Do you go by Linta? Shall I address you as Linta?
Linda.
Linta, okay. Linta, my name is Shinsen. I'm your OET examiner for today. So tell me a little bit about yourself.
My name is Linda Sherian. I come from Alapura. I completed my nursing graduation in Government Medical College Hospital, Kottayam, and I have 1 year experience in dialysis and nephrology ICU in the same hospital.
Okay. So what are we taking the OET for now?
I choose OET because it's a professional-based language efficiency test, and it is mandatory to go and work as a registered nurse in English-speaking countries. So that's why I choose OET.
Where are you planning on going to or migrating?
I plan to migrate Australia because it's a well-developed country, and I can, if I get chance to go Australia, I can work as a registered nurse over there.
So Linda, what motivated you to choose OET, not OET, as a nurse? What motivated you into the nursing profession?
Okay, I chose nursing because since my childhood onwards, I have a strong determination to to become a nurse. So that's why I choose nursing, because moreover, it's a noble profession, and we can serve the people.
What are some challenges that you've had at work, and how have you overcome those challenges?
Okay. I'm working in Medical College Hospital in dialysis department. One day, one of our renal patients come with fluid overload. In that time, I'm the only assigned person in that unit. Suddenly, I'm little bit scared, but fortunately, we have some standing orders in that hospital. So I gave some medicines to him, and after that, I prepared and cannulated the patient for hemodialysis. After 10 minutes of start the hemodialysis, he was stable. That was one of the very difficult situation for me.
Alright, so today what we're going to do is we're going to do 2 role plays. Okay.
Good afternoon.
Good afternoon.
I'm Linda Cherian. I'm a registered nurse working in this hospital ward. Okay. Firstly, I'm very sorry to say. Firstly, I apologize for you the delay of your father's surgery. So may I know what is bothering you?
Linda, I think your hospital and your staff has demonstrated gross negligence. Yeah, a total lack of professionalism. My dad was supposed to go into surgery at 10 a.m. in the morning. There's been no communication. It's about 11:30 right now. We're heading into lunchtime. He has not had anything to eat since last night. We've not been given instructions whether he's okay to have any fluids, if he can use the restroom. Nothing's happened, So in this interim, we're just sitting as lame ducks. What's going on? There's been no communication all along from your team or from the doctors, anyone. And I'm just very irate and very pissed off right now.
Okay, I can understand why you are feeling like this, but one thing I would like to inform you that this surgery is delayed due to because in the post-operative time one patient is got some complications, so that's why this surgery is delayed. I really apologize for that, because in the next list your father is the second person, so it is necessary to wait at least 5 minutes. So I know that your father is not eating anything from the anything in the last night, so that's why we are giving some IV fluids to your father. So there is no need to worry about it. We are giving this IV fluids. That's why he's not feeling any fatigue. So
no, that's not right. You have not given anything to him since this morning. So there's no IV fluids. Last IV fluid that was given to him, administered, was last night. He's not had anything to eat since then, or no IV fluids or anything. And now if you look at him, he's tired, he's lethargic, he's fatigued. So, there is a lack of communication here. Is this part of your common etiquette, or, the standard of care that you'd expect at a hospital like this that's not been administered?
Okay, I can understand your situations, but please try to cooperate with me, because I already said that because these post-operative complications can be unavoidable. So the patient condition is little bit.
But you're a multi-specialty hospital, right? You have an OT theater. There's several OT theaters, so it's not. At least the common courtesy would be that you'd inform your patients. The other thing would be you would schedule that around those dilemmas. Like, it's not probably the first time when you're having post-operative problems or complications that's happening. So the doctors need to communicate. You need to communicate that. Your team needs to communicate that that's not happened, or at least if in that interim. So you would advise us what is possible to do. We don't know what was okay to do. Is it okay for him to go pass urine? I don't know that. I've been holding my dad in a holding pattern. That's not appropriate, right? So I don't know whether he's okay to drink any water, if he's okay to eat any food. He's not taking any of his medications. He's a heart patient, right? So total lack of professionalism. You're giving me excuses, but this does not compensate for anything that he's been going through. I really am I feel that I should discharge my father and take him to another specialty hospital.
Okay, I can understand your feelings, but this surgery is very important for your father. So I really apologize for that. And
I understand that the surgery is important for my father, but apparently it doesn't seem as if it's important to your team. Because, if the surgery was supposed to happen at 10 o'clock in the morning, we've been prepping for them since last night. I've been coaching him and telling him and talking to him about that. So all that's happened, and now 11:30, nothing's going on.
Okay.
So.
Okay, I can understand that. You already said that you want discharged from here.
Yes.
But if you are gone to another hospital, your father's surgery is a little bit again delayed. So that's why it is very important to keep your father right here.
Okay, let me ask you this: with what level of guarantee, with what level of probability can you tell me that there will be no such lapses that will be continuing in communication, in professionalism? With what level of guarantee can you tell me that?
Okay, I can understand. I assure you that the next patient is your father. I assure you that there is nothing to be worried about it. It just take about 10 minutes. After within 10 minutes, your father within 10 minutes.
So is this 10 minutes Indian Standard Time? Is this 10 minutes Indian Standard Time that we're looking at?
Thank you for this.
Thank you.
Good afternoon.
Good afternoon.
I'm Linda Sharan. I'm a registered nurse working in this hospital ward. Okay. You seems to be worried. May I know what is bothering you?
Yeah, Linda. Thank you. Thank you for meeting with me today. I was having some chest problems, and now I'm stable. Of course. I'm just here to see what are some of the options. What do I need to do to get into a better lifestyle choice, and what do I need to do? To become healthier. So what options do I have, and not go through this, so I can continue my level of stability, health stability, and be healthy.
Okay, I can understand your concern. You are diagnosed with a myocardial infarction. You know that.
Yes.
Okay. There is little time to take back to your normal life by taking by follow the doctor's advice in a regular manner. You can recover a normal life, and you can expect a fully recovered life. Okay, could you please are you taking your medicines in a regular manner?
I do take my medicines regularly. I do have a hectic life, but I do make it a point to take it regularly. I am really paranoid about what is going to happen for the future of my life, so my family's there, my wife and kids are there. I have 3 kids, so I want to make sure that I'm around to see them grow up and get married and everything, so yeah.
Okay, I can understand your feelings, but if you already said that you are taking the medicines regularly.
Yes.
That's a good thing. I appreciate you that you please continue this.
I have a question for you, nurse. Do I need to take all the medications? There's a ton of medications. There's about 12 tablets or something the doctor's given me and prescribed. So do I need to take all of them? Is that all necessary? Can I cut those down to maybe 4 or 3 or something? Is that possible?
Okay, I can understand why you are feeling like this, but we are prescribing medication to our patients according to our patient's disease condition. So that's why you are admitted here 10 days ago. So that's why now you have 12 tablets. After sometimes after the doctor's assessment, if you are stable, the tablets will be reduced. Is it okay with you?
well, not really okay with me because I would prefer just taking 1, 2, or 4, but now, I'm having to carry all these around, look at the dosage, all that is there, so.
Okay, I can understand, but it is very important to taking these medicines in a regular manner.
I completely understand that, yes.
Okay. Could you, do you have any habit of smoking like that?
Yeah, well, I am a smoker. I smoke about a pack to 2 packs a day. I work in a stressful job, so I'm a federal contractor with the government, so I have to have security clearance and national security matters. I'm always on the road, so there's always bids that we're working on, so always on the road, busy. Don't get a lot of... I started off smoking as a way of coping with all the stress, and now it's become pretty addictive that I cannot get off that, so that's the problem there.
Okay, are you ever tried to quit smoking?
Yes, I've tried different cessation techniques, cessation methods. I've taken patches, that's not worked. I've done some counseling, that's not worked. So it doesn't look like I'm going to be kicking the habit pretty soon.
Okay, you have a strong determination for that. So that's why you have a strong determination. And I'm happy to say that in our hospital, we have some quit smoking programs are available. And in your condition, it is very important to give up smoking. So are you willing for attending these quit smoking programs?
I have done similar programs. That's why I was telling you I've tried these cessation programs, but they have not borne any fruit, so that's why I'm not sure. There might be some challenges to making these lifestyle changes that you're recommending right now, so I'm more than eager and happy to listen to your advice, but there might be some challenges.
But no need to worry about. In our hospital, we have more expert counselors are available, and they have more clinical experience. And I assure you that if you are attending this program, there are you already said that you are taking the nicotine patches are also, and you are attending these classes. It will give more beneficial for you. So are you willing for attending that classes?
Sure. Well, I'm not working right now, so I had to take some time off from work. Actually, on that note, when can I get back to work? What time am I looking at in terms of recovery, and when can I get back to work?
Okay, that's I already said that there is little time to be taken. And now it is important to take more rest and do some of the exercises. Are you doing any kind of exercises?
Yes, trying to do some exercises. Thank you.